I guess I'll start. Thank you so much for joining, Nasiphi. So as you know, I am Gabriel from the OIC, and I support the Becoming a Health Professional course in the health faculty. And we created a little component called HIV and Me, which is about talking about how sexuality, HIV, affects the way we think about healthcare and affects the way we act as healthcare professionals as well. Yeah, and so maybe to start, do you want to just say hello and maybe introduce yourself? Tell us a little bit about who you are.
All right, so my name is Nasiphi Gwiji, and I am currently a second year Masters in Public Health student at the University of Cape Town. And I am specializing actually in social and behavioral science, and my research is looking into women's sexual and reproductive health.
Okay, great. And do you want to tell us a little bit about your involvement with the HIV and me component? You've been involved for a couple of years, hey?
Yeah. Okay, so I've been involved with the HIV and Me component of the Becoming a Health Professional course in the years 2015, 2019, and 2020, and I suppose this year as well. I'm heavily involved in the transformation space, if I can call it that, at the university. So it's always just so important to also branch out into other areas or other opportunities that give you a chance to learn, to express yourself, and also to contribute positively when you can.
Sure, yeah, thank you so much for that. And I guess why is it important for us to still talk about HIV? So, I think in South Africa we've talked about it a lot.
Mm.
In
Yeah.
school, people have learnt about it. Why should we be? Why is it still important? In your opinion?
In my opinion, it's important because we speak about HIV in different ways. I've obviously been a pupil or a student in high school and also in primary, and the way that we spoke about it then is different to the way that we speak about it now in the spaces that we're in. And I think also the UCT space is very privileged because we also speak about it in conjunction with other topics such as consent and stuff like that, class, race, and gender. And that's not something that a lot of people get to experience. A lot of people just get fresh out of high school with the knowledge, the little knowledge sometimes that they have. Sometimes it's spoken about in terms of religion, maintaining strict terms of sexuality, just heteronormative, a manner of speaking about HIV. And that can be problematic in a growing population, in a curious population. And so to get to the problem of HIV, to get to the issues that are deep within the HIV problem in South Africa, we really need to start talking about it in different ways in conjunction to the actual work that healthcare professionals do in their day-to-day lives.
Yeah, thank you so much for that input. And I think you're highlighting the importance it has not only in our personal spaces, but
Yeah.
also in our professional spaces as well. Especially those of us who are working within the health professions,
Yeah.
where it plays a huge role, not only because of the numbers in terms of HIV in South Africa and on the African continent, but
Uh-huh.
also in the ways stigmas and discrimination, etc., plays out in this space as well.
Yeah.
And
Sure.
I guess it kind of builds on the question I just posed.
Uh-huh.
When I think that HIV though is not only about HIV/AIDS, the disease we combat. It also
Yeah.
tells us a little bit about our struggles for sexual and reproductive health and bodily agency and autonomy. So you mentioned consent as well. And I guess the question I want to ask is, what does HIV teach us about broader struggles for, sexual and reproductive health or against GBV? What can we learn from HIV if we want to think about these broader struggles?
If I thought of myself as a healthcare profession, say I'm a doctor, I'm a nurse, and I'm speaking to a patient, and I'm about to tell them that they're HIV positive, right? That's just me interacting at that moment with a patient that is HIV positive, but the background could be they're HIV positive because they are in a relationship where there's a struggle for power. And perhaps in this relationship, they have had to maybe concede to having sex without a condom with their partner. That's the story that I don't know. I just know that I'm about to tell this patient that they're HIV positive. So that's just one example of how HIV, the disease, can teach us about broader issues that are happening in our society. Another example could just be a young person who maybe never even knew that they had HIV and they're very sick all of a sudden. And I have to tell them that they actually are HIV positive. But the part of the story that I don't know is maybe they had a mother who was HIV positive. Fortunately, they were not able to prevent their child from being infected with HIV. And now they're living with the disease. But this was never spoken, this was kept as a family secret for many, many years, right? And now they have to deal with this reality because of stigma. Because how does a child look at their mother after they know that they contracted HIV from them? How do family members interact with each other once they know that one of their family members is HIV positive? So that's for me, if I put myself in that position, that's how I would think of HIV and the way that it can actually teach us about the other broader aspects and issues that are happening in our society.
Sure. Yeah, thank you so much for that. I think you're highlighting quite well the elements of stigma and discrimination, HIV stigma in particular, and how that's going to play out within our family spaces, but also between healthcare professionals and the communities or individuals that they're supporting or servicing as well.
Yeah,
And so I think you've kind of answered this question, but I want to ask it a little
yeah.
bit more explicitly. Is
Mm-hmm.
you've mentioned the stigma and discrimination, and we know that stigma and discrimination plays a role in the way excluded and marginalized groups kind of access healthcare. And what,
Yeah.
in your opinion, or how rather, does stigma and discrimination play a role in the way excluded and marginalized groups can access healthcare? So, how does stigma and discrimination play a role in the ways we can access healthcare, or maybe the barriers it puts up in terms of access?
Probably I would have to, at the top of my head, say that these groups of people probably didn't have any access to healthcare, and maybe did, but through other diseases. And that's just the interesting thing about HIV. It manifests itself in the stages of AIDS, later on in other diseases such as TB, meningitis. And at that moment, then that's when they actually are able to get tested for HIV. They're able to speak on their battles. For example, we can talk about sex workers, right? These are people, these are individuals that choose to do this kind of work and they do it at night. And during the day, they too ashamed to access healthcare like the rest of the population is. But if we have people going to them where they are and educating them, testing them, giving them condoms and the like, then it helps. But it has been such a struggle in South Africa to actually do that. And the work is not yet done. There's still a lot of work to do. A lot of funding needs to go into these programs and a lot of work needs to be undone with healthcare professionals as well, in communities as well, because it's not only just that I, the sex worker, I'm afraid that I will be judged when I go to the clinic because I've done this to myself. Also, the person that I'm sitting next to is a community member who knows that I do this work and might be upset. Why are you here? Why are you taking up space when we need to get to the front of the line and get help because we are the real patients? You go out and do this work and infect yourself with HIV. You go out and do this work and infect yourself with various sexually transmitted diseases and infections. And so I can imagine that this has created such a huge barrier to individuals who we consider to be from marginalized communities from accessing healthcare.
Sure. Thank you so much for that reflection, Nasipi. And I think what you're hinting at is that healthcare professionals need to take or develop some positive behaviors that can, respond to exclusion within the health system. And what do you think are some of the positive behaviors healthcare professionals can inculcate or can take on to try and respond to those inequalities?
I would say leaving your personal opinions and beliefs at home and looking at the individual as your patient. That's just the first step. This is an individual, a human being that is in need of medical care and medical attention that you can provide. And just going back to the oath that healthcare professionals take, to serve, to protect, to do no harm, and to think about the kind of harm that they could possibly be doing when they hold certain stigma and beliefs about people. And also, I think just in the general sense of how would I describe it, to support colleagues that can do the things that we can't. For example, with in terms of termination of pregnancy in South Africa, right? And there's still a lot of like stigma with that, lack of funding for abortion clinics, and some healthcare workers actually opt out of doing that kind of work, while some continue to do it, believing that they are providing an essential service to the public. And sometimes there's backlash within the healthcare community, with healthcare professionals just butting heads with regards to that kind of work being done. There's pushback from communities. And so if even the healthcare community can just let those that can do that kind of work do it whilst they do other work, I think that would be a great start. Because when we start to interfere with the work that we do, we take time away from the effort that can be put into remedial work, efforts to rehabilitate communities, to make sure that healthcare programs continue to work smoothly. So I think that's quite important. Leave your personal opinions at home, which is a very hard thing to do, but we really need to start putting ourselves, and I suppose also in many other types of jobs, to start putting ourselves outside of it and bringing the mindset of servitude. I'm here to serve despite who you are, who you think you are, who you think you might not be, but I'm here to serve you.
Yeah, thank you so much for that reflection. And I think putting the person you're serving first is really important, and also highlighting that we have our personal opinions, but those might not be the best opinions to respond to
Yeah.
the needs of the individuals in the communities we're serving, because our opinions often come along with our biases, and we all have
Yeah.
biases based on where we grew up, the community we grew up in, the family we're from, and we need to make sure those biases don't influence the way we're treating people. Yeah.
100%.
I wanted to shift the tone of the conversation a little
Uh-huh.
bit.
Yeah.
So, you've facilitated a lot of the sessions with young people as part of the HIV and Me course in the past, yeah?
Yeah.
And the question I want to ask is, what are some of the craziest myths the young people you've worked with had about HIV and about sex and sexuality? Do you remember any of, the craziest myths young people who've, been part of this course before held on to?
I would say maybe the most present or consistent myth has been just how HIV is mostly affect poor individuals or individuals from disadvantaged backgrounds. And of course, there have been some consistent myths and beliefs that HIV and sex work goes hand in hand. And as well as the LGBTIQ plus community. But I would say that, for example, and we put in the work into that, that's what's going to serve the community best. Not when people are going by the book and not paying attention to what's going on around them. Because when you are a healthcare professional and you're placed in a certain community, the needs of that community may be different from community B. And if you're stifled and you're not curious and you're not amazed, you don't want to learn, I think that's the thing that will set us back truly with the issue of HIV, AIDS in South Africa and the continent in general. So those stigmas are still, and those myths are still persistent.
Yeah, thank you so much for that, Nasifi. And I think related to this is what you're highlighting is that the young people who have joined the workshops we had in the past in a pre-COVID world, it led to many of these first years self-reflecting on some aspects. And for the class of this year, what
Mm.
would you suggest are the key points they should self-reflect on when it comes to the content of this particular, component? So, what are the key aspects of HIV and Me you would suggest the group reflect on as key things that could help them develop their practice?
To learn, there's a lot of information here. To reflect on yourself and what you've thought about when you think about HIV in the past. to realize that when you do this kind of work, you'll need to do it with the highest level of dignity, the highest level of confidentiality. And even if their thoughts are not as, can I say, woke as we would like it to be, but it's a safe space. And obviously, we hold to each other in those spaces. And when we've facilitated the workshops in person with confidentiality, so we need to do this work with confidence when you think about HIV and what it does to someone's self esteem, what it does to someone's health and someone's future. I would say if you are doing this work and you're watching the videos and maybe it is during the consolidation class, there's someone that's speaking and there's someone that you think their views are very interesting, try get hold of them. Try make some form of connection some way because it really is difficult to do this work away from the classroom. But I think if you can just get that one person that you think I could learn from this person and I could share my views, just hold on to that and hold on to curiosity and hold on to what the imagination can do for a growing, standing, and I would describe South Africa as also a vibrant country, you know. We want things to work out. We want to always look at the possibilities. So just think of yourself really and truly as a partner and a stakeholder in that kind of work and the greater good that you can do. So just hold on to that. Just hold on. There's a lot to learn and there's a lot to get through. So yeah, that's what I would say.
Yeah, thank you so much, Nasipi. That's really great. Yeah, and thank you for joining this chat this
Only a
afternoon.
pleasure.